I had a German Shepherd who had an ear infection, and I called the animal clinic. Earliest available they had was, I don't know, 5:30 or so in the evening. I said, I'll take it. I took my big German Shepherd in, and Dr. Lange and I started talking, and I had to do the initiating, of course. All girls know that. I sent him a note, asked him, to send me a reply. I waited and I waited and I waited and I waited. And I said, this guy is just not into me. All of a sudden, I got an email response and he wanted to meet up. The rest is history.
One of my frustrations or pet peeves is that I'll give a dosage to have the pet owner give the pet, and later they'll tell me maybe at the end of the 10 days the medicine should be gone. Well, they only gave half the dosage because they were afraid of hurting their pet, and it's just so frustrating because if you give half the dosage, you're probably not helping your pet.
Sit back and enjoy the simple things that you see every day, whether it be your children or it would be your pet. Relax and enjoy it. He not only is treating the patient, which is the dog or the cat, but he's also treating the person, the owner. In many respects, his job is more twofold than mine is. I'm just treating the patient. He's treating the patient and the owner.
I have some pet owners come in, and I have had some that have a list every time the dog had a bowel movement, how many times it urinated. Maybe I don't need quite that much detail, but they're just so meticulous because they want to give us all the information we need. But it's almost like they're just have a fixation.
I can't even.
Good evening, everybody. My name is Dr. Daniel Lange. I am a small animal practitioner, veterinarian. This is the second episode of our podcast. And my wife was just walking down the driveway. I grabbed her at our house, and we're just going to talk a little bit how we first crossed paths, and we'll go from there.
I had a German Shepherd who had an ear infection, and I called the animal clinic, and the earliest available they had was, I don't know, 5:30 or so in the evening. I said, I'll take it. And I took my big German Shepherd in, and Dr. Lange and I started talking, and one thing led to another, and I had to do the initiating, of course. All girls know that.
Yep.
And I sent him an email. Actually, I sent him a letter. I sent him a note.
Those were in the olden days.
Yes,
no
right,
letters
when we were writing. And
we just have the Pony Express out here.
And then
so.
I asked him, to send me a reply. And I waited, and I waited, and I waited, and I waited. And I was on the phone with my best friend in Indiana. I said, this guy is just not into me. And all of a sudden, I got an email response. And he wanted to meet up, and the rest is history.
We have what we call the Katy Trail in the area. It's an old train track, and now there's bicyclists and pedestrians that walk on it. And our first date was running on the Katy Trail.
We went for a jog.
And it was the end of December. It was a couple days before the end of the year, so it was a cold.
Yep.
But I always kind of tease because I have a partner, and Susie had seen my partner for many years. She had lived in Indiana before. Now she had moved back to the St. Louis area, and so I think that he was not available, and that's why they put her with me.
That's right. And then both my daughters ended up working down at Elm Point as well, which was interesting because when I finally broke the news to them that, hey, I'm dating Dr. Lange, they were like, Mom, that's just not cool. And they understood that.
Thank you, Frankie.
Sorry, the dog
just belched or burped.
Sorry,
yacked.
It's a little crazy around here, but no, that they were fine with it. It was just interesting from a teenager's point of view to see their mom dating again and dating their boss. So there you go.
Well, and to give myself some discredit or so, they were kennel attendants, and at the time we had the kennel in the basement, and I worked upstairs at the treatment and surgery area, so they didn't know me very well. But they got the idea that I was kind of a cranky guy. And so when we had our first date, they suggested to their mom that maybe she needs to take some ammunition just in
You
case.
said you were crabby.
Exactly. Well said.
Yeah.
Type of thing.
Yeah.
Well, the other story, Danielle is our youngest daughter, my stepdaughter, Susie's daughter. And it turned out that one day, Danielle, I think was her first day or so that...
It's her first day working for you, yeah.
And it was a Saturday morning. I was just minding my own business. I was writing up some records. It was like 7:30 on a Saturday morning, so things were still kind of quiet. But all of a sudden, I got a call that one of the dogs had jumped the fence in the kennel area. And of course, I was just freaking out because the dog started running down the road. It was still early Saturday morning, but the road was starting to get kind of busy. And I could just see calling these people here. They had a perfectly healthy dog. It got run over by a car, which it didn't. But 100 stressful things, you sometimes want to think the worst. And so we went running down the road, and probably not quite a half mile, there was a trailer court. I was in my running mode at that point, so no problem. But some of my fellow workers got in their cars or trucks, and we all started. There was probably about 12 of us. We went down the road chasing this dog, and we thought we had it cornered at the trailer park. All of a sudden, the dog started turning around and went right back down the road that it had come up. And then before we knew it, the dog jumped right back into the fence area. And so we didn't have to worry. I didn't have to worry about the pet, calling the folks, my worst nightmares. But Danielle, my youngest daughter, thought that she'd probably get fired on the spot because of that crabby guy. And it wasn't her fault, but she thought she was doomed.
Well, no. She came home.
That was my version. Go ahead.
She came home saying that you were crabby ass that day, and that you gave her like the look from hell, like she was the employee that screwed up, let the dog escape. You were going to be stuck with the bad job of calling the owners and saying, "Sorry, your dog's been hit by a car," and yeah. That's what happened. So
but it had a happy ending anyway.
That's our experience with the animal hospital and how we met. And my daughter's working down there,
and both Danielle and her sister Alex both were the kennel attendants, and they both were good enough to get into the Naval Academy. And so I tell people that if you want to get into one of the military academies, you have to clean dog and cat poop. So I just want to pass that on to the listening audience. That if you clean poop and you have a military inclination, you just talk to me and we'll get it worked out. But now we just laugh all the time about that little adventure with the dog. Of course, it's much funnier in retrospect than it was at the time. But that's how we became kind of a family, and got better to know Susie, and got to know. Actually has 3 daughters, so we got to know everybody pretty well over the years.
So Susie, were you always an animal?
I've always had pets. I had my first horse. I got my first horse when I was about 35 years old. And I had ridden all my life, but had my first horse when I was about 35. And then, of course, with work and raising kids and everything, those kind of hobbies fall by the wayside. And the girls got older, and I met Dan, and he lived out here, and the barn was empty. So
just had 3 barn cats at the
I
time.
quickly filled it up, and my first horse that came here was a horse from Indiana. My daughters had gone to a summer camp in Indiana, and I called the camp. They had an equestrian unit in the camp, and I called them and asked them if they had any type of horses they were retiring. And sure enough, they had horses that they used for all of the presidential inaugural parades, and they were in the process of getting ready for the next inaugural parade, and they had some horses they were going to retire that had been in previous parades. So I adopted one of their horses, and I had him for a very long time. I've unfortunately just put him down just a couple months ago, but he was the love of my life, and he was in Obama's first inaugural parade, so whatever year that was. Yeah, He was a great animal, and he was my first horse out here.
And I think he just had been ridden so much that
Yeah.
he did develop arthritis. We've had a couple equine veterinarians come out,
Yep.
and we tried some treatments, and for a long time with medication. And Susie was diligent. Twice a day, she'd be given.
We gave him a wonderful, wonderful life, and he lived to be 30 plus years old and was fabulous. Even when I couldn't ride him anymore, I kept him and loved him, and he was a real gift. So that's how I look at animals. I look at them as gifts, just like children, and I took good care of him. I gave him a really good home.
She did indeed.
So, yep.
When did you know this relationship was built to last? Was it the free animal care?
That helped. Frank, come here. Frankie, come here. I don't know. What was the?
Well, to explain to the audience, your heritage was out here. I mean, it was just one of many
Oh, that's
things.
true.
but,
That's true. My great grandfather lived here and moved here, immigrated from Germany, and lived here and in Nemelli, and he had several hundred acres.
And actually, it's just a couple miles down the
Just
road.
a couple
It wasn't that
miles
far,
down the
so,
road,
yeah.
and so I kind of had a link here, and so I felt at home. This was my home. I'd always heard of Nemelli and the wonderful things about the community, and it just kind of everything just kind of fell in place. Everything worked out.
I'd always had told Susan a few times we would sit out, as I mentioned in the first podcast, we'd sit out, and I just feel like all the neighbors were just looking at us. And so now, having this open area, people will complain about all the animal noises, but certainly much better than the human noises. So I think partly Susie liked the atmosphere, just
Yeah.
the quiet that
Yeah.
we have at night.
You want to go get him?
Oh, I think he's fine. Then, let's see. Did you get to see his career unfold?
I did. It was fun to watch Dan. And he's always been very, very conscientious. I'd always tell him, I'm a nurse, so I'm around a lot of medical human doctors, and I always feel like the veterinarians work 10 times harder, are 10 times smarter, and don't make as much money as the human doctors. And if you think about it, veterinary medicine, you don't just have to know one anatomy and physiology of one animal, you have to know several. And the people that go to vet school, to me, are much better rounded, much more well-rounded, and I think there's a higher level of intellect than human medicine.
And this is a paid advertisement, I think.
Well, but you also have to think on the fly. The animal's not talking to you and telling you where it hurts. And
Oh boy.
yeah, so that's how I feel about the difference between human medicine and veterinary medicine. I just feel like veterinary medicine is much more complex, and it's not as advanced as human medicine is.
A lot of times we'll talk about the differences between human and veterinary medicine. And because a couple of days ago, somebody asked me, they were concerned their dog may have cancer. And I said, well, and we were going to do blood work initially. And I said, well, we don't have a specific blood test to check for cancer at this point. I always say we're 10 to 15 years behind the level of human medicine. But at this point, if an animal has cancer, our best chance is doing an X-ray or ultrasound or something of that sort.
We use a lot of the same medications.
Yes.
But the doses, that's the thing. The doses are so crazy different. And it's just funny because you would think like humongous horse would use 10 times the amount of the same medicine, but sometimes it's just the opposite.
Yep. metabolism of dogs
Yeah.
and cats, like a hamster, are much faster. They're going to break down the medicine much
Yeah.
quicker than a human or, again, a dog versus a horse. And I have had actually human doctors as patient, well, as clients. The patient's the animal. And they just knew they were going to hurt their animal if they gave the dosages I had recommended. And I was always trying to figure a way, well, you stick to the humans and I'll stick to the animals, but I could never figure a diplomatic way of telling them. And one of my frustrations or pet peeves is that I'll give a dosage to have the pet owner give the pet, and later they'll tell me, like maybe at the end of the 10 days, the medicine should be gone, and they still half of it. Well, they only gave half the dosage because they were afraid of hurting their pet. And it's just so frustrating because if you give half the dosage, you're probably not helping your pet. And some of these medicines are fairly expensive, and so it's always kind of a drive.
Also, in veterinary medicine, also uses a lot of human medicine that really isn't used much anymore. That's a little bit more outdated.
Yep, it's true.
But veterinary medicine is still using it and is still current in veterinary medicine. So it's interesting. It's really interesting to talk about that.
Okay. Susie, have you ever needed to step in and help?
I'm not a very good assistant. Dan will
Yep.
tell you that.
I tease her, I'll go ahead and interrupt, that we have Lizzie, our cat, needs some pills. And by the way, a couple days ago, I did give Lizzie the pill on my own, so I just want to let you know.
Good for you.
For some reason, Susie gets upset with the cat because it's passing tapeworms. And as some of you pet owners may know, tapeworms look like little pieces of rice. And we have
It's disgusting, Dan. It's just,
No, it isn't. It's part of life.
It's disgusting.
But we have a black blanket on the bed, and of course, it may show up. If Lizzie sleeps on the black.
It's too much information.
Oh,
Just
that's
stop.
okay.
Just stop. Okay.
So anyway, she would not, in my opinion, be a very good assistant, and so she could not hang on to Lizzie while I gave the pill. Well, we both got frustrated, so Lizzie has not been medicated. But a couple days ago, I was kind of Lizzie and I could be kind of good friends to a certain extent, maybe not anymore. And I finally got the medication into. But Susie just was trained as a human nurse and not as a medical veterinary nurse. So we appreciate each other's abilities. Go ahead.
We've had some good experiences. We've had some hens that have had some problems. We've taken care of hens.
Yep.
We've nursed back peacocks. He put a cast on a peacock.
Broke its leg.
Broke its leg.
Yep.
Yeah, the dogs, the cats, the pigs. Pigs have had some lacerations, and we've taken care of those.
So there is good teamwork.
There is good
Yep.
teamwork.
Yes.
I could never work for him. Yeah. That wouldn't happen.
Maybe we need to change the subject or something.
We probably need to change something, yeah.
So what goes on in the day-to-day life nowadays?
In the morning, get up early. We always have morning chores, and I'm usually the first one up. Get out to the barn, have chores in the barn. Everybody needs to be fed. This time of the year, it's really important to have fresh water and lots of it for everybody. Water is the critical thing this time of the year as we get into really hot weather, and shelter. They need to have shelter. And then we both head off to work. We get everybody settled, and we both head off to work. The days he's working, he's working till about 6 in the evening. I'm usually home earlier, and I start on evening chores when I get home. And once again, that's feeding and watering and checking on everybody and kind of getting everybody tucked in for the evening. And yeah.
Well, I haven't made this too public, but sometimes my pet owners will come in with an emergency, and they're so grateful that I will wait to have the emergency to help treat the animal. And I kind of wink at them and said, well, if it becomes dark, then I get out of my chores. So I welcome these emergencies. And but now it gets a little trickier because the days are getting longer, and we're only open till 6. So my goose is cooked, so to speak, now that even in emergency, I still have to do my evening chores. But actually, Susie does more than her fair share of it. So I complain, but I have no right to complain.
So there's a good balance there.
Pretty much, yep.
I love the long daylight hours. I love it, love it, love it. Because I'll be out here in the evenings, and if I'm not working, if I'm charting, I'm a nurse. I'm always charting. I just was charting in the barn and hanging out. We have some baby chicks in there, and might as well chart with my people. So I was out charting, and I just love being outside because we have so many months of cold and darkness at 4 o'clock, and I just really appreciate this time of the year.
And a lot of the animals, they're curious. Even the pigs, they'll come and see what's going on. We have two potbelly pigs, Peaches and Pumbaa, and they a lot of times like to have their belly scratched. And then if the geese are having a good day, especially the mister of the group will kind of attack. And I was telling Calvin earlier today that we really don't need any burglar devices, that we have the two dogs, the peacocks and the geese, and so they do a pretty good job between one
I feel
another.
sorry. I came outside one day and the poor Amazon driver had pulled down the driveway and was on the roof of his car with the package going.
Is it one of those ring doorbells?
Yeah, and he was surrounded by the dogs and the geese, and I'm like, oh, I'm so sorry. He's just like, lady, I just want to get out of here. So,
And they've come enough that now they know the geese are actually the bad ones. They know if they give a little treat to the dogs that everything will be fine.
The geese will get you.
The geese can be kind of aggressive, so we kind of have a reputation, and sometimes for some reason they just leave the package at the end of the driveway, but we understand.
So I think I know there's a lot of couple dynamics that are in the medical field. So what advice would you give to the younger couples entering this line of work?
Younger couples
Words
that
of wisdom.
pardon me?
Words of wisdom.
I think my words of wisdom to any younger couple now would be sit back and enjoy the simple things that you see every day, because they're all gifts. And whether it be your children or it would be your pet or what kind of weather you're having that day, it truly is a gift, and enjoy it. Sit back and just relax and enjoy it, because those are the things we get so caught up in social media and life, and we have our devices and we don't sit back and realize, like right now we're having a beautiful evening. It's absolutely gorgeous out here. Yep. And
Surrounded by tech.
right. Just take a deep breath and take it all in.
And there have been a number of studies that when people pet their animals or the animals are in presence, it lowers the blood pressure. I always tease that I think that the veterinary bills they pay should be included in the medical taxes, because to me, you pay the psychiatrist, psychologist, whatever, and I think the animals are very therapeutic. So I think I should try to have amendments to the law that any veterinary bills should be included in medical deductions. And I say that tongue in cheek, but I truly feel like there's so much that the dogs do, and studies just show you decrease your heart rate, you breathe maybe more on a regular basis instead of getting worked up about different things. And it's just the touch of the animals, and you come home in the unconditional love. It's just something you just don't see around us. And just to come home and have a dog, for the most part, not too many cats wag their tails, at least in our family, and I'm teasing. But the dogs, they're just so happy to see you. And sometimes we just go out to dinner and come back an hour later. And, I don't think they have a sense of time. They're just happy to see, even though it hasn't been that long a period of time. So a lot of pretty interesting things
They're
with their
very
pets.
therapeutic. Animals are very, very therapeutic. I recently lost my mother, and I've done a lot of therapy right out in the barn. There's been a lot of therapy out there. There's been a lot of nights where I've been talking, and maybe they're not talking back to me, but they understand.
They're good listeners.
I do think in their psyche, whether it be large animal or small animal, they understand and they feel that vibe that you're giving off.
Animals are very attuned to body language, and I think they pick that
Yeah.
up when you're depressed or having a bad day, because we hold ourselves differently. And then when we get excited, they get excited. Oh my gosh, what's going on around here? And it truly is amazing. I mean, all the years I've done this, I just learn more and more. We just don't give enough credit to our pets, all the abilities that they have, but they just are strictly attuned to body language, and it's pretty interesting, both as a pet owner and as a veterinarian.
I believe that too.
So it's
Yeah.
They can sense danger from
Yep.
a mile away.
Oh,
Yep.
they can.
Yep.
They can. They can.
and sometimes people will come home and maybe the dog defecated inadvertently in the house, and they say, well, my dog knows it did something bad. Well, it turns out it's not so much what the dog did, but when you have your hands on your waist and you kind of have that frown, the animals pick up on the body language and they know that you're angry. They don't know exactly what it is, but they know you're upset. And so again, it just comes down to that body language that they don't know the dirty deed that may have done, but they do know that you're upset of what, for some reason.
Is it safe to assume there's a lot of work talk at home?
Oh, I tell them about my day, but it's so different because it's focused on like our healthcare system and all the pros and cons, mainly the cons of what's going on in our healthcare system right now. And he doesn't have to deal with that. He doesn't have to deal with really insurance or people getting discharged too early or whatever. But he not only is treating the patient, which is the dog or the cat, but he's also treating the person, the owner. So in many respects, his job is more twofold than mine is. I'm just treating the patient. He's treating the patient and the owner.
And it's interesting, we talked in the first podcast how I love talking to the people, and you just don't get that in vet school. It's just strictly learning all the animal, and I think that there should be more classes on dealing with people, our skills, because again, we're not trained to talk to people. And over the years, I've learned that, and that's what I enjoy doing, as I mentioned before. So it's,
Who spoils the pets more?
Oh, I do. Definitely. I always have a carrot. I always have a treat. I always have something for somebody, whether they deserve it or they don't. And 9 times out of 10, they don't deserve it, but they still get it.
well, I've just been trained just to clean stalls, so I don't know how to feed animals.
Yeah.
So there's equal responsibility.
Yep.
Cool. Okay. What are you most proud of building together?
I think just all the animals that we have, that we're not insane. I mean, we do have some teamwork. I will take Louie, our little corgi in the background there, or corgi mix. I've been taken for a walk because he was overweight when we first adopted him, and I feel pretty. And again, it's just a minor thing, and it's not so much the exercise, but I feel like a lot of times we don't give enough stimulus to our pets. We just expect them to go out in the backyard to potty, come back in the house, and that isn't enough. And I never realized it until we started taking walks. He loves to go for walks, and I think it's just all the different smells and different parts of the environment that it just makes his day, for lack of a better word. May not be a whole lot, but I just think people need to make more of an effort to take their animals to a walk or for a walk in the neighborhood or a park or something like that. And it's good, of course, good exercise for everybody. So that's kind of my little expertise, or my job is to walk the dog.
Do you two ever get annoyed with your friends and family asking for free advice?
All the time. Yes.
I don't get.
But I don't. It doesn't. I mean, it doesn't
No,
bother
we don't
me.
get annoyed by it. It does come pretty frequently. And there's nothing worse. I always tell Dan, when you're in a group of people and somebody finds out that your husband's a veterinarian, they're like, oh, I got to tell you, my dog's doing this and my cat's doing this. I said, it reminds me of a man or a woman who's an OBGYN and they've delivered a gazillion kids and they run in to a woman or a husband whose child they delivered and they're like, oh, remember me? You know, you delivered my fourth baby, you know,
20 years ago.
seven
Yeah.
years ago, and I was the one, you know, and they're just like, yeah, right. It's the same way with Dan. These people all come in and they want to talk to him, or they want to show him their pet trick, and you know, stupid pet tricks. That's what it reminds me of.
And a lot of times they just may have the pet sit and all you know, but they're just so tickled that they can spend the time to be with their pet and do simple tricks. And it doesn't bother me because I know I wouldn't have a job if people didn't have the bond that they do with their pets. So it's all good.
Yeah.
There's always a lesson. There's always a lesson that you learn every day. So
Right.
What's something that you learned recently?
I just get kind of tickled because a lot of times it must be osmosis, but because I'm a veterinarian, she knows all the animal stuff as well. So as she kind of intimated before, that people will ask her questions as well, because she owns animals or she knows me. You know, it's not always that simple. Yeah, by association.
Oh, and they
exactly.
spend hours telling, like at Christmas parties and stuff. People will spend like an hour telling me about their dog's digestive problems, and I'm just like, okay, he's not even there. Like, okay, you know.
You want me to call him?
Right.
But again, overall, we take it as a good
Yeah.
thing because it's people love their pets, and sometimes they'll show it by telling every little detail on their pet. I have some pet owners come in, and I have had some that have a list every time the dog had a bowel movement, how many times it urinated. Maybe I don't need quite that much detail, but they're just so meticulous because they want to give us all the information we need. But
yeah.
it's almost like they're just have a fixation.
I can't even get patients to record their daily blood pressure readings.
See,
I
pet
can't
owners
get, I
do
can't
better
get
than us
people to do
humans.
that. Yeah.
It's almost like they need somebody to do it for them.
Right.
All the time,
Right.
right?
But it's all part of the life, and I take
Yep.
it all good. It's not a bad thing at all.
Any interesting cases recently that kind of stumped you?
Well, on the first podcast, I mentioned the dog that was down on its back legs and just some of the difficulties financial wise. I mean, we give an estimate to everybody on what we're going to do, and sometimes it's just more than the people can afford, and so sometimes that makes it more difficult. And you know, probably on average every day, and this is probably more information people want to hear, just kind of the down, that either a pet dies that we've been working on or has to be euthanized. And there is a very high suicide rate in veterinarians compared to a lot of other occupations. And I think that that's one of the factors involved, just because compared to human doctors, I've read that veterinarians have 5 times the death rate with animals with our pets than the general human practitioner. And so that's kind of a downer. But we've had, you know, just some dogs come in, and I know a couple days ago a lady came in and she was all upset because the dog was passing blood in its stool. Well, it turned out that it had an abscess or infection of its anal gland, which is on the outside of the skin near the anus. And so something that could have been horrible turned out was relatively simple. I know, Susie, I'm sorry, too much information. But it's nice sometimes when things are relatively simple, when the people are coming in, they're almost in tears, and you find out it's something relatively easy to treat. And I've just had a couple cases in the last week that turned out that, you know, it could have been a horrible situation because they were older pets, and turned out it was something relatively simple to do. So sometimes it's nice that I have the knowledge that I can tell them right there without running all kinds of diagnostic tests that
It's okay, Susie. This is medical
Yep,
professionals.
yep.
speak.
This is therapeutic
Yeah,
for
I
me.
guess. Okay.
It's all
okay.
about me Calvin said it was all about me. On
Okay,
this.
okay.
Language Pets podcast. So we're gonna try a segment for the episode. We're gonna play Who's More Likely.
Okay,
So I'm gonna ask a question.
Okay.
Who's more likely to do this and that?
okay.
Give us your answers. So who's more likely to sneak home with a stray animal?
Me. Oh, yeah. I'm a sucker. I'm a big sucker for strays, for the downtrodden. You name it, I'm a sucker for it. Any animal.
I'll teach some of the pet owners I hate to go home because there may be new additions
Right,
to
with
the
the
family.
exception of a reptile. He doesn't have to worry about a reptile coming.
We know that too.
Yeah, that's not going to happen.
Who's more likely to Google symptoms instead of trusting the vet?
Oh, I do that.
I don't think it's so much Susie. I know a couple times this week I've gone and told the owner I knew what was going on, and then I wanted to go back to my office and write some notes because I hate just to verbally. I know when I see a human doctor, sometimes with a nurse, they're throwing so much information at you, and I don't think people get all the information. So I like to make some notes. And so I explained the one condition to the lady. In 5 minutes, I came back in with my written notes, and she had already Googled everything about the disease. So it was almost like I wasted my time writing it down because she had already visualized or read about it. So I think it's more the pet owners. And most time it's good, but we tease that there is a Dr. Google, and Dr. Google is not always right. So sometimes you have to kind of worry about the source of the information. But in many cases, I think an educated pet owner, overall, it makes it easier for all of us so they kind of know why we're doing what we're doing. So I think having all that information available is a good thing. I know I was a little off track, but
No, that's completely relevant. Who's more likely to make a medical joke no one else?
Make a medical what?
Who's more likely to make a medical joke that no one else gets?
it's me. Because I feel like the whole world, I'll make a joke on heartworms, and most people don't even know what a heartworm is, and I'm just laughing or
That's a
giggling.
funny one.
Or on the radio show, and Susie gave me her 2 cents worth on anal glands. I just have some kind of fixation.
Stop talking about them.
And I expressed the anal glands
Nobody
a
wants
couple
to
days
think
ago, and it was
about
all
it
over
or
me.
Much,
and
no,
so I just made a big joke about it.
Stop. Okay, stop.
So did we answer your question?
Yeah,
Calvin?
we're finished. We're finished with that.
I think you hit the dot.
So I make more of the jokes there, and most of them aren't that funny.
Who's more likely to spend too much at the pet store?
Probably me.
With the treats?
Oh yeah, that's me. I'd spend way too much. I spend too much at the feed store. Yeah, that's me. That's me. Yeah. See, they agree.
So this is kind of analogy, but replace the word lizard with something else. Who's more likely to forget there's a lizard in the fridge? So misplacing your pet. Or that might not hit.
Misplacing your pet?
Yeah. So like misplacing your pet in a, like, oh, you left your dog somewhere. You forget. Like leaving the dog at the pig pen.
Oh, yeah, no, we have done that. We have done that on several occasions. They will slide into one of the horse stalls, and we shut the stall, and then we're calling the dog, and they don't show up, and you don't know where they are. Actually, that little freak has a oh shoot, what
Shock
is it?
collar type thing.
No, it's the little AirPod. He has an AirPod. AirTag on him, yeah. Because he was down at the neighbor's house one night just having fun, and I couldn't find him and he wasn't responding, so I put an AirTag on him.
And we have an invisible fence, but he went right.
Yeah,
something
he
really
just,
got his
no,
attention. He
he
went
just,
right
so
through the
I put
invisible
an
fence.
if you need to find your luggage, you can find your luggage. If you need to find your dog, you can find your dog. That's how it is.
Okay, next question is, who's more likely to say no more pets and then bring home a new one?
I'd be the one to say no more pets, and Susie sees something cute or something that'll fit into the family.
Yeah.
And it'll just be just a little bit more work, so not that much.
Okay. Who's more likely to talk to animals like they're people?
Yeah, I kind of do that too.
We both do.
But probably
yeah, we
maybe
both
Susie
do.
a
We
little bit
both
more.
do.
But they're
I
such good
s-
listeners. You know, it's almost like they just cock their head just a little bit. It's like they really are picking up on what you're saying.
Okay. Let's do one more. Who, let's see. Who's more likely to name every animal at the clinic?
To name them? Oh, that's me. I name them.
I know my limitations, and that's not no.
Most of our pets are named after somebody from like my childhood. Some of them are named after some of the sisters that taught me, some of the nuns, some of the priests. Frank is named after a local in Indiana when I lived in Indiana. And yeah, we name them after people.
Is there a outlandish name that you've come up with before?
I named my horse Mr. Big. That's from Sex and the City.
He is a big horse.
He's a big
Tennessee
man.
walking horse.
He's a big man. I named him Mr. Big. Yeah.
Okay.
We, you know, we had one dog many years ago, and the dog's name was Shit. And we go into the waiting room. You know, there's 30 people in the waiting room, and we're ready for Shit. So
That's funny. That's funny. Okay. So we'll do one or two more questions to close
Okay.
out the episode. Let's see. After all these years, what's one thing you still admire about one another?
I just admire the every day Susie, no matter the weather, will be out there taking care of the animals. She's just very well disciplined. Sometimes I get aggravated. Okay, 6 o'clock, even though I don't have to be at work till 8 or something, but we gotta take care of the animals. So nobody takes care of the animals better than she does. So I tell the animals they're pretty lucky to have her, but she does excellent care of them. And it's more than just taking the dog outside, you know, with all the critters we have.
I admire Dan because I never see him really get angry, upset, really frustrated, and he's always positive. He's always very positive about everything, and it's always very nice to come home to that. To always come home to a positive person. Not.
And see,
negative.
that's why I want to talk about anal glands, because it makes me so positive, but Susie just kind of shuts me up
Yeah,
right away. So.
Yeah.
Is there one animal you haven't treated or owned but secretly want to?
That's a good question. Would you want to have more large animals? See, Susie, before we met, I was a small animal because I've had dachshunds and Cairn Terriers like Frankie, and she's had more of the German Shepherds, so she's kind of the large breed. And I was worried that what will we do down the road, and she's been very good at compromising, but would you want to have another large breed dog?
Well,
or Shepherds? Or
I don't know so
Island
much.
cow?
A cow. You like the cows. You always say they're very. What do you say about cows?
Well, they're just so inquisitive. They're very gentle creatures. Now, I'm not talking the bull that's not been neutered. It's in mating season, but at school I did a little work. We did work with cows, and they're just unbelievable creatures, putting up with being checked and examined and all that. So,
Is there a specific breed? Because a lot of people
Yeah.
like the breed of Highland cows.
Mm-hmm.
Is there a specific?
Is there a specific breed?
no, I just don't know if I want to milk a cow twice a day. So,
Right.
I think I've gotten too practical. So I don't think
Maybe,
that.
maybe be an uncle so you can visit cows. Have your
It's more fun just to visit, you know.
Okay.
Yep.
Can you think of anything else? You like exotic? Well, and not with the crew we
Yeah.
have, but I had told on the first podcast I really like rats, working with rats because of the good
Oh
personalities.
no, we're not getting any rats.
well, see,
That's
that answers the
insane. That's
question.
just nasty.
But rats,
that
because
is so nasty.
they're
Dan.
prey,
Oh
probably don't
golly,
work very
damn
well
those
with dogs
nasty
that are-
tails and everything running around.
Yeah.
Forget it.
Okay,
Forget it.
so. Again, did we answer the question?
It goes Extra
Yeah.
credit there. Okay.
Or maybe we each have wishes, but we know the other wouldn't be much of a fan, so maybe that's, you know, where we've kind of stopped right now.
Okay. Let's see. Anything you want to say to your younger selves or to the audience as final words? Or
I don't know. I just think a pet, if you haven't had a pet, you have the time and the financial resource to take care of it. I don't think there's a better situation to have an animal.
It's a responsibility. That's
Right.
what I want to say to people. It's a responsibility, and you don't have a right to have a pet. They're a responsibility, and you have to understand that there's cost involved in it. It's just how it is. They don't do their job for free, and their time isn't for free, and having a pet is a privilege. That's how I look at it.
Yep. I'm into that. I agree.
Yep.
Because it is such an emotional thing. People just see this cute creature and they don't think of all the consequences or things they're going to have to do. And a lot of times it does cause problems.
Yep.
Or if they have a spouse, maybe the spouse isn't an animal, or they already have 4 kids. I have had cases where a young lady brings in 4 kids and they just got a new puppy. Do you really need to have a 5th kid? I know they do it because the kid would like to have it, but I had 3 siblings. You know, we kind of were until we got our dog, we could kind of have fun from each other. So I think sometimes having an animal is not always, or, you know, once the kids get old enough and they're going to soccer and gymnastics and all that, the dog's gonna be spend a lot of time at home. And so I think it's hard, but I just think you need to try to think of the consequences. You're gonna have that dog for 10 to 12 years.
Okay.
Okay, shut up.
Okay, yeah.
Okay,
Stop.
sorry. I got.
Yeah.
all right. So I think go ahead and close out the video. You know, say.
Well, thank you for all watching and listening, and we'll see you down the road on more podcasts. And this was kind of the spur of the moment with my wife Susie, and so I was happy that she played along. And the weather is actually really nice, Calvin, right
beautiful.
now.
It's
It was
beautiful.
kind of hot and humid earlier, but it's beautiful
great.
right now.
It's great.
So,
Yep.
looking forward to see you all down the road.
Tell them to like, subscribe, and comment.
Like him, yes. Thumbs up. Press a thumbs up. Tell them you like us. Subscribe.
We appreciate it.
Yep.
But we will keep in contact down the road, and if you do have more questions, we'll give more information how to contact myself.